Hi, I'm Ernest Meshack-Hart, General Dentist, Dental Director here at Reilly Health Services, and I'd like to welcome you to our clinics. We're a large community health center serving rural and urban communities in southwest Idaho. I don't think it's an exaggeration when I say we live in probably some of the most beautiful country in the U.S. Lots to do and see here in the Boise area. If you love the outdoors, then you'll really enjoy your time and your rotation here. Lots of hiking trails, biking, both summer and winter activities. We've had students in the past who've been able to make trips out to Yellowstone, Craters of the Moon, not that far away. Rafting the Snake River in Hell's Canyon, Bruno Dunes, Sawtooth Mountains, and even if you're not into sports, you gotta check out the blue turf at the Bronco Stadium. Really adventurous, you can actually get a potato B&B. That's right, living in Idaho. We have 9 clinical sites spread throughout the valley from Homedale through to Boise. Some are large, interdisciplinary, multidisciplinary clinics with 7 to 8 chairs, and we've also got 2-chair single doctor practices. We also have a mobile van, and we routinely participate in outreach activities. So a little bit about our patient population. We serve a pretty diverse patient group. We have patients who are mostly low income, like most other community health centers. You've probably heard the saying, if you've seen one FQHC, you've seen one FQHC, and ours pretty much holds true to that saying. Right now we have several clinics across the Treasure Valley, and even between the clinics there is some variation in the patients that we serve. At our large clinics we have in Boise and Nampa. At our Boise clinic we have a significant number of refugee patients from all over the world. Several of our appointments require the use of translators and interpreters. On the west side of the valley, over in Nampa, in some of our clinics, we have a sizable number of migrant seasonal farm worker patients. So if you speak Spanish, that comes in handy because you'll definitely get to utilize that skill in our clinics. Most of our patients are on Medicaid, anywhere between 50 to 60%, depending on the clinic. The vast majority, like I said, are low income. As far as our scope of practice, we have a pretty broad scope. We do everything, well, it's probably easier to tell you what we don't do. We currently don't do full or complete dentures, and we don't do ortho or implants. Other than that, we pretty much see it. I've had patients as young as 2 weeks old, and my oldest patient was 102. So we cover the whole gamut. Depending on who you're working with and who your preceptor is, some of us have a passion for removable, oral surgery, endo. The vast majority of what we do is your standard bread and butter dentistry, though. We do a lot of extractions, a lot of fillings. As an extern or student in our clinics, you will probably be seeing a lot of urgent care. Depending on how long your rotation is, you may get to follow through with those patients. It's not uncommon for us to get patients who come in as an urgent care patient. With all our patients, we encourage them to establish care. We do practice and encourage comprehensive dentistry. So they may come in for a toothache, and you may do an extraction that day, but then you may get the opportunity to actually bring them back, maybe do an exam, and maybe do some fillings on them. So we do get to, for about a lot of our patients, kind of see them through treatment completion. Obviously, with the length of your rotation, you may not get to see all of that, but most of your initial patients will be on urgent care, but that can lead to a variety of experiences. Mostly extractions, mostly fillings, but sometimes can be more, the occasional root canal, maybe even a crown. For some rotations, we do have the opportunity to provide mobile dentistry. We have access to a mobile dental unit, which is a kind of a van, an RV, which has been retrofitted with a dental chair. And so that can sometimes be available depending on their rotation, and some people have found that to be a nice experience. Depending on your future interest, that may be something you want to check out. It's very similar to practicing in the clinic. You're doing the same kind of dentistry, just in a slightly different setting, and need to have a little bit more creativity and flexibility because things don't always go as planned. Some of our dentists do get to provide care off-site at assisted living facilities, intermediate care facilities. So if you have an interest in either geriatric dentistry or special care dentistry, some of our students in the past have gotten an opportunity to experience some of that. One of the benefits of being an integrated practice is being able to work side by side with providers from other disciplines, medical, behavioral health, pharmacy. We routinely share patients. We haven't perfected the process, but it's something that we continue to work on because it does improve the care of our patients. And like I said, we're pretty fortunate that we have an awesome group of dentists here, and dental assistants and dental hygienists and administrative staff that I feel work together to try to provide the best care that we can for our patients, and the best experience for our students who come in on rotations. Like everything in life, some days go great and some days you kind of have to roll with the punches. You will get those patients where they are immensely grateful for the care you've provided, and you'll also, some of our best teaching experiences have actually come through visits where the patient was less than happy with how things were going, but it's a great opportunity to not only learn about the technical skills of dentistry, but I feel something that maybe we don't spend as much time talking about, which is just that human element, learning to treat the patient, not just a tooth, but also learning to work together as a team. So that's something that we really get to work with, and like I said, we have a great team, really talented dentists and support staff. We have dentists who have lots of experience in different aspects of dentistry, and all here to try to provide a great teaching and learning experience for our students that come by. This is our Canyon Dental Office, where most of our students have been spending their time between here and in Boise. Especially with our newer clinics, we are standardizing the equipment, so most of the time you'll be using ADEC equipment, air-driven handpieces as we use rotary endo. We are all digital, both in charting and imaging. We use Open Dental and XDR, and we are currently using Centricity for our health histories and scheduling. For materials, we use a lot of glass ionomers, just given our patient population, but we have composites and amalgam if you want to, and if it's appropriate and indicated. But we periodically review our materials just to ensure that we have the best materials that are indicated, and constantly looking at the evidence. But pretty typical for your dental office. Not bad. Except I wasn't recording, so let's go take a All right, now I know what I'm doing, so here we go.
Better together in Boise, Idaho!
Yay!